Concussions are found in all ages and all sports across all different demographics. With football, volleyball, soccer, and men's and women's, we see a number of concussions in all of those programs.
As an athletic trainer, what we look for concussions is any contact during the play or practice, any hard contact hits that might jerk the head at all, and any abnormal behaviors if the athlete ends up holding their head or just staggering a little bit. We look for that on the field before they come over to us for an evaluation.
There are many different symptoms that we might find in a concussed athlete. The more common ones are dizziness, confusion, possibly loss of balance. A description of being foggy is a fairly common description of a concussed athlete. The trick is trying to determine whether, the headache that someone has or the dizziness that they have, is that associated with a concussion.
We have a very highly trained group of medical providers who manage concussion on an everyday basis.
Every Friday night I'm on somebody's sideline. We typically evaluate patients that are concerned for concussion right there on the sideline and do a detailed exam to see if it's safe to return back to practice. And one of our mottos is, when in doubt, sit them out.
Concussions occur in every sport, therefore it's important for St. Luke's to make sure that throughout the year, summer, spring, fall, winter, that we're offering courses and educational opportunities for parents and coaches and school guidance counselors, school nurses, to make sure that whatever the sport, whatever the activity, they understand the seriousness of concussion. Athletic trainers at St. Luke's can be found in the secondary schools, middle schools. We work with a number of youth programs across the region and with elite club teams like Lehigh Valley United and some of the other national teams like the Parkettes Gymnastics Squad. The St. Luke's Physical Therapy team has a number of concussion centers, now numbering nearly 20 across the valley, that are positioned to make sure that athletes who need specialty rehabilitation can get it close to home.
What sets us apart within the Lehigh Valley is our team approach for concussions. Everyone working together to rehab the patient is key.
As an integrated team, we work with physical therapists, neurologists, primary care sports medicine physicians, and other individuals like neuropsychologists to make sure that our athletes are ready to return to the field when it's most appropriate.
We'll follow their return to play and treatment program at a high school level through the athletic trainer. Once they can show that they no longer have any lingering symptoms and their baseline testing is normal, we can get them back to practice and games safely.
It takes a village to manage a concussion. But at the same time, that village has to be a village of experts. And that's what you would expect here when you come to St. Luke's.